Good morning, Dr. Yang.
안녕하세요.
Nice to meet you.
네.
Before we start, can you please introduce yourself to our viewers?
네.
Hello there. I'm the head of Korea's Hugo Plastic Surgery Hospital, Yang Song-hyuk. I'm in charge of the anti-aging operations, eye procedures, and under-eye procedures at Hugo Plastic Surgery.
So, Dr. Yang, today we'll be talking about facial liposuction,
네.
right? So, what is exactly facial liposuction?
Facial liposuction. Well, when one's face has excessive fat, it can look bumpy and can cause sagging in the face due to the weight. So in this case, by going under facial liposuction, it would be the best way to smooth out a bumpy and uneven face. Facial skin is made up of subcutaneous fat, deep fat, and a muscle layer. With facial liposuction, we target the deep fat layer, or we remove the fat, including some subcutaneous fat. Then, the subcutaneous fat gets thin, thus creating a slimmer face by smoothing down the bumps. Also, in the area of deep face layer, there's a kind of fat called buccal fat. If that's removed at the same time, then one could achieve a smoother look.
So, doctor, which part of the face can have liposuction?
With
네.
facial liposuction, it can be done in any part of the face which has fat. In Korea, if our cheekbones look wide, it would not look favorable. So in order to downsize it, facial liposuction is done. And by removing the fat around the smile lines, it can also help reduce the sagging. The most common reason as to why the patients get this done is to highlight the jawline or to remove the excessive fat that results in a double chin. By improving that area and other areas with excessive fats, the look of the jawline gets improved. And that's one of the reasons why facial liposuction is performed. Especially with the fact that I mentioned earlier, that there's a fat layer called the buccal fat. If this fat is too large, it'll start to sag or give that form of uneven skin. So, in this case, the incision is made inside the mouth in order to remove the buccal fat.
See. So, for liposuction, for face liposuction, it can be performed in many parts in one operation. Is that possible?
Before the patient proceeds with the procedure, there will be a consultation session with a doctor. That's when the patients tell us which parts of their face they want us to work on. So through the consulting, they tell us where they want the procedures to be performed, such as the cheekbones, the smile lines, or the double chin. And then we would plan out what would be removed. So yes, the procedure can be done all at once.
So it's possible.
네.
Usually, on average, how long does this kind of surgery take?
This procedure is fairly quick. Most of the time, it takes around 30 minutes to an hour. It is performed while the patient is under anesthetics. There are some people that worry about the pain, but rest assured, they don't have to worry about it.
Usually in Korea, now we're talking about Korean people, what kind of liposuction they do a lot?
In the case of Koreans, most areas of facial liposuction are performed right around the jawline, such as under it, where the so-called double chin can occur, in order to improve the neck area or stop it from sagging any further. Some older patients, or patients who feel they have a larger face, would get facial liposuction around their cheekbones and the smile line areas. But the most common area really is under the jaw.
This is one question that many patients ask. For the result of this kind of liposuction, does it go forever? So is it permanent?
Well, facial liposuction is a procedure that reduces the amount of fat cells inside a person's body. For example, if there were 10 fat cells, by getting rid of 5 of them, then there will only be 5 of these fat cells on your face, and the number will most likely not increase any further in the possible future. So, if you go through liposuction, this effect will last permanently.
So after the surgery, the fat, it appears in the liposuction area or it doesn't appear?
Yes, once a fat cell is gone, its numbers don't start growing anymore. But if you eat a lot and gain weight, then those fat cells grow along with you as well. So there could be some bloating, but the numbers don't actually increase. The fat cell itself gets bigger, so you might feel that you gained weight. But if a patient went under a facial liposuction before, it won't be as bumpy or as saggy as before.
So after the surgery, the recovery takes a lot of time. How much on average does it take?
So this recovery period relates more to the swelling, in my honest opinion. Right after the operation, there will be continuous swelling for over 3 days. And after that, it will subside little by little. So, to reach the point where you can go back to normal routines, it will take 10 to 14 days for bigger parts of the swelling to disappear. After that, the swelling will continue to subside, and after 1 whole month, you will notice that the swelling is noticeably gone.
Are there any side effects for liposuction?
The most common side effect with this procedure is bleeding and swelling. To prevent bleeding and swelling, we normally use compression dressings or bandages. The reason behind this is that after you take out the fat cells in the fat layer, the newly evacuated parts won't have anything in it, and so blood will fill that space. And once blood fills up, there will often be hematoma and swelling. And so to minimize the swelling, it is important to put pressure on those evacuated parts. So, if these compression dressings are put on well, we should be able to prevent bleeding and swelling. Aside from these, liposuction doesn't have that many side effects, so there really isn't any reason to be worried at all. But sometimes, people can go overboard. For example, I would like this part to be slimmer. Please, can you take out more of it? So, with these requests, I will try to take out more fat as smoothly as I can. But if too much fat is taken out, it could cause pavement in the skin, or if the fat layer gets too thin, it could cause skin necrosis. Although this isn't a common occurrence.
So, one of the side effects also could be skin sagging, right? Is there any method to prevent skin sagging?
So, you would have to take into account the elasticity of the skin on your face to prevent any form of sagging. For example, patients who are old or have gone through other procedures and as a result have less elastic skin. If you take out a lot of fat through liposuction, there will be sagging that occurs. And so, after the liposuction, you will be seeking a fix for the sagging via facelift or a thread lift. So for patients who expect or anticipate extreme sagging, should also take into consideration getting a facelift and not just a liposuction.
That was it for facial liposuction? Can you just give a thank you to the viewers and then we'll move on to the other?
We have so far explained what liposuction is, the uses for it, the side effects, and how we can prevent it. People who are considering liposuction often have a lot of concerns. But if you come to Hugo Plastic Surgery, we can discuss the various problems we can fix with the procedure of liposuction and parts that we cannot. Thank you for listening. I'm Yang Sung-hyuk from Hugo Plastic Surgery.
Thank you.
감사합니다.